I am Dr. Muzaffar Shah-Khan, and this is Perspective with Dr. Shah-Khan. Before we go ahead and get started, make sure that you subscribe to my channel, like, comment, hit the bell notification button so that you are notified of all of my new videos and new content. Share this video with your friends, family members, your haters even. I don't care. I have plenty of them. That just kind of comes with the territory. But I would certainly appreciate that. This video, I think, is probably one of the most important because it's the most personal to me. All of you that are my colleagues, this is kind of my advice to, my fellow doctors and healthcare workers. We are in the midst of an epidemic, right? This is a crisis. This is something that pandemic, excuse me. It's something that, I definitely never experienced this before, like ever. So, listen, like I get it. Okay. I very much kind of understand. A little bit about me, I am a new business owner. I'm an entrepreneur. I'm a doctor. I'm a trapper. I'm a surgeon. I encountered countless hurdles to even open my business, from construction problems, permits, and then even more afterward, right? Like dealing with unreliable and like incompetent staff, right? Insurance companies not paying, patients smoking post-operatively, right? And then complaining of like problems. I get it, okay? As a dentist and surgeon, however, we have the highest possible risk since we actually work in the mouth and we do for long periods of time. As we know, this is a respiratory virus and the cells actually live in the throat and larynx. Majority of my new practice is oral surgery based. So if a wisdom tooth, for example, is difficult to remove, as a lot of them are, of time that I spend close to that patient, or us at risk, excuse me, because I'm talking to my doctors now. Dentists, surgeons, dermatologists, PCPs, other healthcare workers, it doesn't matter. Like, we all have to be extremely careful right now. I'm also the son of a doctor. Okay, I'm the younger brother of two specialists. Both of my sisters actually see very sick patients regularly. One is a cancer specialist and the other is like a very busy nephrologist. So whole thing, it's just like super personal, like to my family. It's just very personal. Several dentists who are still doing procedures. Like everyone, we all have businesses to keep afloat. They have staff to retain, bills, mouths to feed at home. Some have let go their entire staff. I'm talking about doctors that have worked for 15 plus years, who do 50,000 by 5 p.m. type stuff. And have multi-million-dollar practices, which I will too, inshallah. But it's crazy, right? For people like that to be struggling right now and that have these huge established practices, big names, all that kind of stuff, having to let go their staff, it's crazy. But, I think someone has to advocate for us as doctors and healthcare workers, and that can be me. I would say COVID-19 precautions started in the US later January 2020. Several of my established colleagues stated that although they started implementing COVID-19 screening protocols in their practices, for example, as dentists, we don't typically take patients' temperatures all the time. I mean, sure, you do sometimes, but that's just not something that we regularly do, especially if we're doing cosmetic cases. But they're doing that to kind of ensure that their patients did not have fevers. So what was happening, right, was that several of the patients did actually have fevers, and they were sick with fevers, but they were taking Tylenol and ibuprofen before their appointments so that they would be able to be seen. So potentially putting everyone in the office at risk, right? Mainly the doctor. Not only is it just shiesty as hell, right? Of the patient, it's just plain unethical. The problem with doctors like myself putting ourselves at risk is what can happen afterward, right? It's one thing to to put yourself in harm's way. That's one thing. But if someone affects us at work, right, and then we go home, we can potentially spread it to other people, our families, our loved ones. I noticed that when things were kind of getting really ramped up regarding like the virus, because in the beginning, people were talking about it and they're like, oh, like the flu is like much worse, things were kind of just like shifting. Like I was actually getting a lot more phone calls to my office for patients to be seen. And some of my like PIA patients that miss appointments were trying to get in to see me. And I was like, no, you've like missed 3 appointments. Like you have to just, maybe if I have time, if you want to walk in, whatever, but otherwise, no. I have 3 pending like large aesthetic cases right now. If I completed like just 2 of those cases, it would make my month. As a new business owner, I have just copious amounts of pressure from like every direction. But the thing is, I have to use my better judgment and just make that call of like not doing it right now or just kind of postponing it to later. I personally live with my parents. They're older and they have health issues. So I have to help them a lot. Like I have to give them their medicine, their eye drops. I like run up and down the stairs like a madman. I'm also a businessman. I have to do my thing, but I think there's like a bigger picture here, right? Than just like kind of making racks that certainly we need. Reported that 51 doctors in Italy that were treating COVID patients have died of the virus themselves. A few in NYC that have died as well. I personally know a physician who's contracted COVID-19 through the workplace. Thankfully, they're fine. This isn't some fake news BS, this is personal. I personally just don't feel that people really respect doctors as much as they should. Really as much as when my mom started her career. I think that's due to a culmination of things, and which I don't really care to get into. I actually do say this quite frequently. I firmly believe that people do not care how much we put ourselves at risk, right? So many young doctors in their 30s like myself, who are just kind of beginning their careers, and we have so much ahead of us, right? We literally have our entire lives, our entire careers ahead of us. And you have these doctors examining highly contagious COVID patients without PPE. What in the entire F is that, right? Seriously, it's just it's bewildering. I don't even know. Yeah. So listen, doctors, healthcare workers, use your better judgment. I totally understand your concerns and struggles. I have a mountain of my own. I could probably cry all about it here, but I'll kind of spare you the Bollywood drama. What I can say is that you should just be safe and be vigilant. You really just don't know who has it, right? So if you're on the front line and you don't have PPE, you're not only putting yourself at risk, but you're putting your loved ones at risk too. And I personally I don't think that that's worth it, right? I couldn't do that in my situation, with my parents, with my family. I would never be able to you can't come back from that kind of stuff, you guys are smarter than most people, so you just got to use your heads. Again, let me know if you have any questions, concerns, comments. Let me know. Those of you that are helping out and that are doing everything, obviously it's very commendable. I certainly respect what you're doing, but at the same time, you have to protect yourself, right? Because I feel no one really cares about there's literally doctors that have died, they're dead, and from treating these patients. What good is that? Seriously, they're trying to help someone and they die themselves. So anyways, it's a tough situation, I get it, but just be safe. That's all I can really say. Take care.